Scott and I have known each other for about 12 years. Scott is one of my partners, and we've had an opportunity to practice medicine together for quite some time. Scott is, in my estimation, one of the most meticulous surgeons that I have ever had the opportunity to work with. I feel that I'm meticulous, and I feel that I have good bedside manner, and Scott puts me to shame. I think that I have never worked with anybody who was as detailed-oriented as he is, and who had a mastery for the operations that he does. His planning is just unbelievable, and that's how he approaches every single operation that he does. A few years ago, when I was diagnosed with prostate cancer through an elevated PSA, I had biopsies done by one of my other partners in our group, and they came back positive for prostate cancer. As a urologist who has all the information in the world and knows everything that I could about this disease process, about every possible treatment, pros, cons, benefits, risks, there was never a doubt in my mind that the surgery would be a robotic prostatectomy, and there was no question in my mind that it would be any person other than Scott Miller. The things that crossed my mind were the complications, the continence and the potency. Well, I know that in radical prostatectomies, you know, the continence rate is very, very high. It's much different than when I was training and this pediatric urologist was doing prostatectomies in training. It was a concern, and if we were doing surgeries like that now, I would be very concerned. But with a robotic prostatectomy where things are magnified so much and the surgery is just so delicate now that you can really get things put back together pretty close to how it was really actually a very small concern of mine. My biggest concern was potency, and that's, I think, every man's fear. And so I really didn't have concerns that many patients have going to see somebody like Scott. I had a completely different set of issues, and so mine weren't about cure or about continence. It was mostly about potency, and I felt that this gave me the best opportunity to continue to have the same quality of life that I had before my surgery, which is how I arrived at that decision. And to me, it's a no-brainer for any man who really wants to remain sexually active. We had the surgery. He spent extra time. He confided in me that he was sweating it a little bit operating on me, but it went so smoothly, and I didn't skip a beat. And in fact, he had spelled out for me how long I would miss work, how long he wanted me to stay out, and I was ready to go back to work within, oh my gosh, a week. I think that anybody who has prostate cancer, who is the right candidate for an operation, would be fortunate to have Scott as his surgeon, and they could, there's a lot of choices out there, but as far as I'm concerned, and I speak with my deeds and not just with my words, I don't think that there's any other decision in my opinion other than going to him and getting a radical prostatectomy done robotically.